Welcome to another MU Healthcare Y107 Ask the Expert podcast. And our guest this time around is MU Healthcare neurosurgeon Farhan Siddiq. And he is talking about why MU Healthcare is the place to go for certified comprehensive stroke care. And we get things started with this question. Why is it important to talk about stroke?
It's really an important thing that we need to discuss. Stroke is one of the major causes of morbidity and mortality across the world in the United States and also in Missouri. It's the fourth leading cause of mortality in Missouri. And 80% of these strokes can be prevented with the appropriate medication, with appropriate lifestyle changes. So that's why it's really important, because this is a disease that we can actually make an impact.
So tell me, what are some of the ways that we can reduce our risk?
So stroke prevention, it's very important to look at the lifestyle. There are a lot of risk factors that we can modify by modifying our lifestyle, such as obesity is one of the common risk factors, diabetes, good control of diabetes, blood pressure control. Smoking is one of the important things. Drinking or the amount of drinking, stress in life, those are important things. Eating is very important. So I think in a nutshell, I think what I would say is the most important way to prevent stroke in elderly or aging population, probably over the age of 50, is regular visits with your primary care physician, so you can discuss those risk factors. You can develop a strategy and plan to reduce and mitigate them. Doesn't mean that you can do all of those things in your younger years too, but it becomes increasingly important as we get older, because the cumulative effect of those risk factors continue to cause changes in your body that predispose you to strokes.
What are the two different types of stroke?
So when we talk about stroke, there's a ischemic stroke, which basically means that a clot originated somewhere in the body, maybe in the heart or one of the large vessels of the brain, sometimes even small vessels of the brain, and then it propagates up to the brain vessels and occludes them and causes a stroke. So that's a common form that we call ischemic stroke. The other form that we also include in stroke, although it's slightly different and the treatment strategy is different, is hemorrhagic stroke, where an artery, instead of getting blocked, it's actually either ruptured or an abnormality in a blood vessel has ruptured and caused a hemorrhage. And then brain hemorrhages also are slightly different from each other. There is hemorrhage either within the substance of the brain, in the matter of the brain, or a hemorrhage on the surface of the brain. But in general, we lump them together. So when we say stroke, we mean 80% of strokes that are ischemic, meaning a clot occluding a blood vessel, and the remainder of 15 to 20% are hemorrhages or bleeding in the brain.
Study up and learn more about how MU Healthcare earned this region's only comprehensive stroke certification. Go to muhealth.org/minutes matter. Doctor, how can you tell if someone you love or someone that you're working with is having a stroke?
This is a really important question. I think we have to all be alert to the symptoms of stroke. And one of the simplest acronym that we use, and I don't expect everybody to remember the acronym, but just to give you a little bit of understanding of what it means, and it's called BFAST. B is for balance or loss of balance. E is for eyes or vision changes. F is for face, such as droopy face. It's a very common symptom, very easily recognizable. A is for arm, like hand weakness, arm weakness, or numbness. S is for speech, any difficulty, slurring of speech or unable to speak, very important, very easily recognizable. And then T is for time. That's just to stress that it's very important, if as soon as you notice any of those symptoms, call 911. And a lot of times these symptoms come all of a sudden. It's generally not a gradual buildup. They just all of a sudden come in. Very frequently we hear a story where a patient was found down, and then when attended to, they demonstrated either one or many of these symptoms.
Be fast. Absolutely. Time is of the essence if you think someone is having a stroke. We've got neurosurgeon Farhan Siddiq with us talking about MU Healthcare being the certified comprehensive stroke care facility here in mid-Missouri. Why is it so important to get that help you need quickly if you or a loved one is suffering a stroke?
So time is brain, especially in ischemic stroke. With every minute we're losing brain cells, and not to the order of 1 or 2 millions of brain cells every minute. In fact, probably up to 1 to 3 billion brain cells. So the longer we wait, the more damage to the brain will happen. Nowadays, we have technology, medical and surgical technology, where we can go in and remove those clots and give you medication that can actually break the clot. But in order for that to be effective, you have to arrive to the hospital very early. And so the quickest you can, the better it is. So immediately, if you recognize somebody having stroke symptoms, don't think about driving them to the hospital yourself. If a patient is noticing any of those symptoms, don't drive yourself. Call 911. get assistance, because those symptoms could get worse very quickly and you may not be able to handle them in transit. Whereas our emergency staff is very well equipped to handle any kind of activity or changes that could happen as a result of stroke. And they also alert us in time. So what happens is that they give us a heads up so that the stroke team is actually ready in the ER to receive the patient. And we bypass the remainder of the ER process and go straight to the CT scan. So it saves a whole lot of time. That's why it's critically important that as soon as you recognize those symptoms, call 911. Don't take matters in your hand. You've done your job. You've identified symptoms. Now let us do our job. And the quicker and the best we can do is going to be reflective in the outcomes of those patients.
Some great advice right there for sure. Learn more about how MU Healthcare has earned this region's only comprehensive stroke certification. Go to muhealth.org/minutes matter. What makes MU Healthcare the only mid-Missouri hospital to earn that comprehensive stroke certification?
MU Healthcare is the dominant stroke provider in this region. We are certified for a comprehensive stroke center. What that means is a comprehensive stroke center has capability to treat any kind of stroke 24/7 all year long. And that requires a lot of infrastructure buildup. But basically what it means is that a certifying body has assessed the capability of the hospital, the experience of the providers, the training program, and the ongoing education at that institution. And that's what comprises of a comprehensive stroke center. So University of Missouri is the only comprehensive stroke center in mid-Missouri. So, we have over the years developed and perfected our system of assessing and evaluating stroke patients. So when a stroke patient is arriving, a stroke page goes out and we immediately rush to the ER prior to the patient arrival. Patient arrives and they are seen within 15 minutes, and a CT scan of the head and CT angiogram is obtained within 30 minutes of arrival. And that's not only obtained, but assessed by a specialized person so they can review the images and make a plan for treatment. And within 60 minutes, we are able to provide IV clot busting medication right away. And within 90 minutes, patient is on the treatment table with anesthesia team.
Wow. That's some powerful stuff. What sets MU Healthcare's stroke care apart from the rest?
So some of the things that I already talked to you about our system and our process, we are able to deliver IV TPA or clot busting medication within 60 minutes, and we are able to provide surgical treatment of ischemic stroke within 90 minutes of onset or arrival, which is really remarkable. In fact, 90% of our patients, TPA can be provided within 45 minutes. So that benchmark we have achieved very successfully for many number of years. But apart from that, what sets us apart is that we have a team of neurologists and neurosurgeons who can not only treat stroke patients with minimally invasive stroke techniques, such as going in through the arteries of either the wrist or the groin artery and removing the clot via minimally invasive approach, but also surgical treatments such as minimally invasive surgical treatment of aneurysms, minimally invasive treatments of arterial occlusion such as doing bypass cases. So some of those things that are not provided anywhere else in the central Missouri, we are able to provide.
Dr. Siddiq, thank you so very much for your time. Again, you can learn more about how MU Healthcare earned the region's only comprehensive stroke certification. Log on right now, muhealth.org/minutes matter.